Canadian organization is a national alliance of rare disease organizations within Canada. We have about 100 plus member organizations, and what we do at the national level is that we actually try to advance policy. That's our most important mandate, is creating policy for rare diseases at the national level, not just with the federal government, but across our provinces and territories in terms of their health policies, but also beyond health policies, obviously looking at policies for disabilities, looking at policies for occupations, looking at policies for work. And certainly one of the most important things we do is try to create a climate in which we can actually advance diagnosis, research, clinical care, treatment, and support for rare diseases. Within that, we also worked with our member organizations to increase their capacity to support their patients, but beyond that also to serve as advocates with us. So we work in terms of looking up in terms of what we need to do with the different stakeholders, with the policymakers, with the leaders, with the companies, but also then with our organizations to help them become much more effective. We always say Canada is sort of like the orphan of the orphans. In many respects, because we're right just above the U.S., we benefit a lot from what the United States is doing in terms of research and development, so a lot of clinical trials that take place in the U.S. Patients from Canada can actually be involved in them if we're aware of them, if our clinicians are aware of them. A lot of the research and development that takes place in the U.S. actually does have a spillover effect in terms of being able to support some sites in Canada. The problem with that is that we don't develop a whole lot within Canada. We have never had, for instance, orphan drug legislation. And when we approach our governments to say, why don't we? Their answer sort of is, we don't have to do that. The U.S. is doing it. And we think this is a tragedy because it also limits the kind of research that takes place, the building of capacity in Canada, but it also means that we also are not investing in terms of research and development for rare diseases. It also means that rare diseases has a lesser profile in Canada than it might if you actually had huge investments in it. It also has meant that in many cases, even when we do discoveries that are for rare disease therapies, the minute those discoveries get to a point where they're actually going to maybe become clinical trials, the companies move everything into the States, or they move them to Europe, where there's actually a much more supportive environment. So we're losing out on that. I think the other challenges we have in Canada is because our healthcare system is very much like a European healthcare system in the sense that we have public health and we actually do provide, comprehensive care for all citizens. The challenges are that we don't really have the same kind of health care delivery issues that the U.S. does, and a lot what the U.S. does then in terms of making drugs available, for instance, are not really applicable to the challenges that we have in Canada. We're much more like Europe in that respect. So we have, in fact, aligned ourselves a lot with what's going on into European policy. We, for instance, have created a national plan for rare diseases based on what the Europeans have been doing. So we find that we have to kind of work, across different borders in order for Canada to actually have a profile in rare diseases. But we also find that because we don't have the numbers, the U.S., there's a large numbers. People work together, they can make an impact. Europe, 26, 27 countries, they work together. Canada, as I keep saying, we're a little bit like the orphan of the orphans, right? We have to keep saying, don't forget us. We're here and we want to be a part of, we need to make sure, because it's a global environment that actually pulls rare diseases and pushes it forward. You can't work at in the same as one rare disease by itself can't do a whole lot in terms of affecting policy. One country by itself can't do a whole lot. We need to belong to much more of these global environments. That's one of the reasons why my other role is actually as chair of the Council for Rare Diseases International.